Okay, and welcome to this morning's huddle, brought to you by Going on Offense. My name is Daryl Moon, and I'll be your host today. And we certainly appreciate you being with us and hope that you'll join the conversation. We have a wonderful guest panelist today to talk about making goals during uncertain times. We're holding these huddles every Monday, Wednesday, and Friday in an effort to support those struggling, to brainstorm strategies to help, to promote resources, and to engage collaboration. Now, to introduce today's guest, it's my pleasure to introduce to you Dr. Paul Larson, Global Health Education Director for UPMC. I'm going to invite Dr. Larson to take 4 or 5 minutes to introduce himself and to share a comment or two about today's topic. But before I do, I want to invite all of you who are participating today to join the conversation. We would love to hear from you. Either send in comments through the questions section on the control box, or if you want to click on the raise your hand button, I'll actually turn your mic on and you can join the conversation through an audio. Dr. Larson, would you like to introduce yourself?
Thank you so much, Daryl. It's very kind of you to have me join you today. I greatly appreciate this opportunity. I wanted to think about this idea of goals. I'm a family medicine physician in Pittsburgh. I work for UPMC, and one of my opportunities is to be able to teach family medicine residents and train them as such, and to teach them global health and to think about the impact of health in other countries outside the United States, as well as underserved populations here in the United States. And one of my opportunities here is to be a college health physician for Duquesne University, which is a mid-sized university here. And so I spend my days largely teaching physicians. During this time of COVID, we've had some quite significant changes in everybody's schedule. And it has created this environment where, although we have a degree of uncertainty at all times, this is unusual in everybody's life. And it's this singular event that has caused this grand pause of everything that people were otherwise planning, and has required people to kind of reorient how they're thinking about going. Any plans that they otherwise had has been interrupted, and I don't think there's anyone that's been spared that. And so there's this opportunity to think about what are some of the healthy ways in which we can approach our own response to this event that's occurred, and what are some of the healthy ways. And Going on Offense has been a very helpful tool and resource to be able to help all of us think about different ways of approaching plans, and making goals is one of those things. So this idea of kind of uncertainty that comes up has this unfortunate effect of promoting stress, both emotional stress, physiologic stress, and lots of different consequences of that, both in the short term and the long term. And it also, unfortunately, has this tendency to undermine our hope, or to promote kind of hopelessness, which is already relatively prevalent. But this idea that we need to have this kind of belief in a positive future, as far as having healthy thoughts and healthy thoughts about ourselves and the choices that we make. Uncertainty has a tendency to undermine those things and to increase stress and hopelessness. We also have this desire as just human beings to have autonomy and to have this sense of, we have authority to make decisions for ourselves, and a very close cousin of that is this idea of self-determination, right? This feeling like we have the ability and confidence to make change and this sense of control over our choices that we have. So when we have events that, like COVID, that completely undermine our plans and cause us to adjust, it tends to undermine our sense of autonomy and self-determination, and can, as a result, reduce our motivation. So this need to kind of motivation that drives our intensity, the direction we're heading, the persistence of effort that we give to any particular goal. So unfortunately, this situation in which we all find ourselves has this rather common outcome of increasing our stress, and undermining autonomy and self-determination, and secondary motivation. And I see goals as a way of combating that. and going on offense as a way of, pushing back against this undermining of our autonomy and self-determination that we all desire, and thinking about, if I can't eradicate the uncertainty, how do I navigate it in a very healthy way? And so that's what's led me to think about, let's talk about goals today.
Love it. Tell me a little bit, Dr. Larson, about your own personal situation. Have you continued to go into the office? Do you still see patients? Are you doing a lot of telemedicine? How has this affected your own personal day-to-day operation as a physician?
Well, here you are, I'm a physician, and usually I'm used to seeing patients, and here I'm sitting in my home office, you see behind me. So, we're at home, and that's very unusual. And how does a physician work when he's at home? Now, I already mentioned that I'm a teacher, so I do spend a large amount of my time preparing or delivering or teaching in some kind of capacity to physicians, and I have a number of different responsibilities for UPMC, but this event kind of derailed a lot of plans. Now, I respect, there's a lot of, unfortunately, a large number of people in the United States that have lost their employment entirely, and it's a very difficult situation to be in. I am fortunate in that I have not lost my employment, and yet the projects that I was otherwise employed to do this year have been completely put on the shelf. So, for example, half of my time I spent as a college health physician. And there are no college students at the university. And so the college health department has closed, and perhaps there may be someone in the summer, but again, that's uncertain. And we're hoping and making plans for college students to return in the fall. That's not yet finalized, but we're certainly hoping that they will come back to the university in September. And so half of my job is now really not possible to achieve. And so I am continuing to see patients by virtual telehealth. So I have a computer here in the home that I can see patients by video conference, just like you and I are speaking, and I am able to see some patients that way. But in a quarter of my time, I actually work for UPMC as far as developing academic medical centers and departments of family medicine in Kazakhstan. And so I actually have business trips that I take, and during this last month and this month, I was otherwise scheduled to be in Ghana last week and Kenya next month, and then Kazakhstan in June. And so all of those business trips, of course, completely put on hold, just like everybody. And so these different responsibilities that you're otherwise asked to really dedicate a year to, you can't really achieve very well. And so yes, it's like everybody, it's you're completely reorienting what you hope to achieve with your time, and hence I'm in the same boat as everyone else, thinking, how can I make goals that really make the best use of my time and are productive for my employer?
Well, I love this idea of setting goals. There's so much that's uncertain. How do you take what you can control and set goals within that area and actually move forward? So let's talk a little bit about when a person goes to set a goal, what are some things that should be the root of the goal that they set? How should they go about deciding maybe a goal that they do have control over? What's a goal that maybe would be a good one to work on? What are some of the elements of choosing a goal?
So the first thing I'm going to say is one good lesson is to begin with the end in mind. So what I mean by that is thinking about, what is a goal? A goal is simply a target that we're trying to achieve. It increases our motivation, our performance. It gives us attention that we can focus on. It energizes us. And it often helps promote discovery of new skills and knowledge. And so all these benefits that I think we all kind of recognize from it. But to be able to come up with a goal that is going to be kind of successful, we need to begin with end in mind. And that really starts from kind of what is our underlying purpose? What is our why? Why are we going about whatever it is that we're doing? So what really fundamentally drives us? Is there a vision that we have? Is there a clear picture of some desirable future that we're trying to bring about? What's our mission? What is the core way in which we're going about bringing that desired future into being? And so starting and remembering, to have a goal and to form a goal, it's not an end in and of itself. We're trying to achieve some desirable vision, some mission that is giving us a direction. And so, sometimes I'll listen to this individual called Andy Stanley. He's actually a pastor in Atlanta, but he's a relatively well-respected leadership guru. And sometimes I'll listen in the car to a podcast. And one of the phrases he has, very memorable, pithy little phrases that he'll say. And one of them is, your direction, not your intention, determines your destination. And so for me, that's helpful because it's not really about what I intend to accomplish. It's going to be primarily driven by the destination in which I'm going. And why am I trying to get there? What's my underlying purpose? What's my vision? What's my mission? And what's my why? And so I would start with the end. So begin with the end in mind, and then we can work backwards to think about, what's a reasonable goal.
I like that. I like that a lot. Once we've got a vision, once we've got a direction we're going to take, then we have to decide, okay, what behaviors, I can't control anybody else. So the goal can't be, I want my spouse or my children or my, my aunts and my workers or whatever. I can't control their behavior, but I can control my behavior. And I know one of the things that I've always been fascinated with is within our minds, there's different sections. There's an amygdala or a reptilian brain that it's not conscious, but has a tremendous impact on our behavior. And often it doesn't like to change. Where our conscious brain goes, I want to hit this direction. I want to go in this direction. And there's this constant struggle going on between the prefrontal cortex saying, I want to go in this direction, and that doggone amygdala that's going, I don't like to change. I want to stay where I am. So I think identifying and just personalizing and figuring out, what is that for me? What are my ruts? What are my struggles? What is that I want to change and I just keep falling back into the rut? And then identifying what those are and then make them simple. What are your thoughts along those lines of the different parts of the brain and our own struggles to try to change?
Yeah, another way of thinking about that is the old idea of the elephant and the rider, because we a lot of what you're referring to is this idea that we're driven by our emotions, and we have to be completely transparent about that and honest with ourselves that a lot of what is driving our decisions and choices and the goals that we're setting are not some cognitive intellectual idea about what I need to achieve. It's really this kind of the emotional state that I find myself in, and that's heavily influenced by our circumstances that we're in. And of course, the COVID situation and this upheaval of everybody's work life and home life. We're working from home. Sometimes that's great. Sometimes that's not. I started talking with you, and my teenage daughter, who usually works right behind me at the desk here, she jumped up and left the room. So it disrupts everybody's kind of work schedule. So we're driven by this kind of emotional state, and I think we have to acknowledge that that's the elephant, right? And how do you steer an elephant? You're this little person sitting on top of an elephant, and I think you just have to acknowledge that if the two of you are going to go anywhere, you're going to have to acknowledge, where am I starting from? What's my amygdala saying? And what are my the benefits, or what are my the strengths that I'm working from, and what are some of the things emotionally that I'm struggling with that are going to hold me back, and start with that and acknowledge that from the beginning. So to steer the elephant, I think sometimes we have to motivate ourselves in a very special way, and acknowledge that sometimes we just respond to emotional prodding, and just kind of be okay with that.
I love that analogy of the elephant and the rider. That's great. I know it has to be small, simple steps too. If we try to move that elephant too far, too fast, it just doesn't move. So finding those simple little things, and I know in some of our previous guests we talked about, we are in an uncertain time, but we do have some control. Maybe staying within our home, how we exercise and how we choose to eat and how we try to keep a mindful, positive state of mind. Simple little things. It's choosing one of those that we can tell we're struggling with, and then make it a simple thing. Talk a little bit about the need to make it a simple goal. What have you seen with your patients?
Yeah, so in fact, I think that's one of the key kind of take-home points is starting small. That idea that if you think of a small goal achieved improves your self-efficacy, right? Achieving a small goal helps build confidence that you will be able to achieve larger goals the next time. And it's kind of like building a snowman, right? You start small, you roll up that ball, and then it kind of builds on itself, and you get this momentum. So what people find is that as they achieve smaller goals, they build that self-efficacy, they gain confidence, and they can start building on larger and larger goals. And when they look back and they think, my goodness, I quit smoking, or actually, I'm not drinking alcohol anymore.
Mm-hmm.
And they achieve these huge, wonderful achievements that they have for themselves that have enormously positive outcomes on their long-term health. But they realize that they started really small. They started, instead of, I didn't focus on quitting smoking. What I did is I actually just didn't go outside to that picnic table during the break. Instead of going out, I went to the kitchen and talked to somebody in the kitchen instead of going out the back of the building by the picnic table.
Mm-hmm.
That was the goal. The goal was not to quit smoking. The goal was simply to go to the kitchen instead of the picnic table behind the building. And so you just, a small goal achieved improves your self-efficacy. And so, yes, we think of just starting with low-hanging fruit. Start with some things that are that you have very high confidence that you will be able to achieve, because actually the confidence turns out to be more important than even if it's very realistic. So if you're more confident about achieving whatever the goal is, you're much more likely to succeed. And so I would start with, what are you most confident in that you'll be able to achieve? What do you in your life consider the lowest hanging fruit? Or if you do have a big goal, then break it down into small incremental steps. So if you can break it down so that it looks like a small goal, even though it's just one small part of a much larger one, that will also have a very similar effect. So break it down or start with something small, and you'll find that those small wins in incremental tasks will build confidence and then positive energy to move forward. So just kind of remember, a small goal achieved will build your confidence.
I love that. It reminds me of a conversation I had on Friday with a health coach talking about someone that she was helping who wanted to stop smoking, and they were smoking, a number of packs a day, and decided they were going to reduce the number of cigarettes per day by 1 per month. So they went an entire month smoking 1 fewer cigarette per day, and the next month they dropped it by another one. And over the course of a year or two, completely stopped smoking, but it was such a small step at a time that, in the end, they were successful. And I think you're right. The confidence that people feel, that we all feel, those endorphins that go off when we're successful, have a tremendous impact.
That's exactly.
Give me your thoughts about, they say that if you want to reach a goal, small or big, whatever it is, write it down, track your progress, and tell someone, kind of an accountability partner, someone that knows that you're trying to make that change. Talk a little bit about what you've seen with those 3 elements: writing down, tracking progress, and being accountable.
I think those are the absolutely very important key strategies to increase anybody's commitment. So as soon as you make your goal public, so for example, if I'm counseling someone on quitting smoking, I would strongly advise them to tell the world, to post it on the social media, to tell all of their friends and family. If I'm going to ask them to give me a date, a specific date, some days hence, so not today, but in a few days, what is the date? And then advertise that to everybody. Tell your workers, your co-workers, your social networking friends, and everybody at home, so that everybody's on board, or at least even if they don't agree with the goal, they understand that you are doing it. So, and people will actually provide an interesting degree of accountability. Sometimes just knowing that somebody else is aware of your goal provides a psychological accountability for you, but also it provides them an opportunity to speak into your life and to say, hey, I thought that you were planning this, or you said that you were going to go for a run during your lunch hour, or you were going to go for a walk around the building because you wanted to increase your physical activity. So I saw you walking around the building during lunch. Why are you doing that? You were just walking in circles around the building. What was your purpose there? And it gives opportunity for people to kind of speak in, to reinforce your goal, and for you to speak to them and say, yeah, I find myself sitting all the time in front of my computer all day, and I just want to increase my physical activity just by 20 minutes of walking. And so the most convenient is just during my lunch hour. And then you may be amazed. Maybe somebody else wants to join you and say, well, that sounds like a great idea. Would you mind, tomorrow during lunch if I walked with you? And then lo and behold, you not only have built confidence in yourself, you've got some accountability, and now you're positively affecting somebody else's choices. So there's all these great ramifications of increasing your commitment. So making it public, writing it down is another way. So if I'm going to give a recommendation, even in a lifestyle medicine change, I'll write smoking cessation or physical activity or nutritional change. The power of kind of writing that down and giving it as a prescription has its own ability to kind of improve somebody's response. So the other way of doing it is asking for feedback. So you can bring other people into your goal by asking people around you, either a spouse or a trusted person at work or a friend or any colleague, and ask them, for feedback on your performance. Say, this is something I'm trying to achieve. How am I doing with that? One of my goals, just as an example for this year, was to get certified in lifestyle medicine. I've been, enormously fascinated by actually the lack of intentional approaches with regard to lifestyle change in my own discipline, and a heavy reliance on medical therapy to address things like diabetes and high cholesterol and high blood pressure. And so wanting to have a better handle on how do I assist people in making lifestyle changes. And so one of my goals is to study so that I can pass the lifestyle medicine certification in November. And so one of the advantages of this COVID month in March and April was to say, hey, I'm going to take a little bit of time to use that to do a little continuing medical education and study lifestyle medicine. So when I take that back into clinical practice, I'll ask people for feedback. I'll ask my colleagues, and I'm going to start introducing these techniques with patients. If you just let me know what you think the patient's response is, or maybe you can even come in the room and observe me counsel and give me feedback on that. So asking for feedback is a very strong way, especially when you're learning new skills, to get feedback, but a sense of, am I on the right path to the destination? And then, of course, the last one I would say there is just clearly state what we said at the beginning, is be very clear as to why the goal is important to you. And often you just need to keep asking yourself that why question, like, why am I doing this? And sometimes we think about 5 whys, just kind of keep asking yourself why. Why is this important? Well, why is that important? And then just keep asking yourself why, until you get to the roots. What is the fundamental root driver? And often that comes back to a fundamental belief or value that you have as a person that's going to be highly unique to all of us. But it's very important to clearly understand why. So going through that exercise. So ask for feedback, make it public, write it down, and ask yourself why.
Nice. So one of our listeners has asked a question. The question is, can you talk about the importance of failure with goals, how to realign and move forward?
Yeah. So I think that's enormously important. So there are a couple of things. One is that we can plan for relapse, right? So we expect, and relapse is really part of the journey of any life change. And so we're not necessarily expecting one smooth ride all the way to success, right? So if you plan for relapse in advance, you'll find that you'll be able to recognize when it's about to occur. You might even be able to take mitigation steps to kind of to miss it if it's coming. But even if you do step off of the path in which was getting to your goal, you'll be able to get back on. So one of the things is just identify the stressors. Like for you, what are the things that really get to you? Is it during COVID, for example, this idea that your schedule is interrupted? Or if, I like to work quietly in a quiet space. And so you see I'm working with my headphones on and I'm in my office here. But if my sons are playing soccer in the hallway outside my office, that's a little bit disruptive. And so there are little things that kind of, I know what causes me a little bit of stress. And so I can anticipate, hey, I'm going to be video conferencing with a friend at 11 o'clock. So maybe during that 1 hour, you could not play soccer in the hallway right outside my office door. That would be really helpful to me. And so you can just kind of identify what are the stresses going to be. And then again, I'm going to reiterate kind of writing down that why, just like we answered the kind of the last question, is write it on a piece of paper, post it up on a wall so that it reminds you. And so when you fall off, which you and everybody does, you can look at it and say, this is what was driving me. This was my motivation. And this was why I was doing it. And I think you'll find that that helps you kind of get back on, as well as the feedback from other people, the accountability you get from making it public. So all of those things that we talked about before will also feed into this ability to get back on when you do fall off.
So I'm intrigued to no end with this conversation we had just a minute ago about the need to bring into primary care more of a lifestyle medicine approach. I'd be very interested to know a little bit about what are some of the things you're learning in this lifestyle training, and the concept of a physician writing a prescription to go change your lifestyle. Talk a little bit about, you know, the power and how it isn't about me, the doctor, telling you what to do, but actually once you get the person to decide what they want to do, giving them that additional support to say, okay, that's what you want to do. I'm going to support you by saying, here's a prescription. You can even say your doctor ordered you to do it. Talk a little bit about the role of a physician in helping people change lifestyle.
Well, so it's really about, so it comes a little bit from realizing that even though I'm a family medicine physician, I have a very unusually broad scope of practice, and yet I still find myself having not been able to learn a sufficient amount of what many people would just think of as the basic healthy lifestyle fundamentals. So it turns out, honestly, that I have not spent a great deal of time thinking about what are the core recommendations to physical activity. So when you're recommending the degree, the amount of exercise somebody should have, how do I recommend to them exercise that is going to be consistent with their abilities, their interests, what they find enjoyable, and how much should I recommend? Or nutritionally. My formal education in medical school is actually surprisingly small in the amount of core nutritional knowledge. So we have wonderful dietitians and nutritionists that I refer people to in my office, but I actually want to be able to talk with people about, you know, what are you eating? Why am I recommending a whole food plant-based diet? What is the benefit to having a whole food plant-based diet? And why are we making the recommendation? And so I want to be able to have this conversation with people. But it's not just about, it's not like writing a prescription. If you take atorvastatin, your cholesterol will be lower. You know, you have a higher risk of having a heart attack. Take this medicine, and your 10 minutes is over. So that's not really what I want to do, is be able to come alongside people and say, you know, what is the journey that you're on? Where are you in this journey? And how can I come alongside you more like a coach would and say, how can I give practical suggestions to you to help you achieve your goals that you are determining for yourself? So these are not goals that I as a physician are coming up with, writing down and giving to somebody, because clearly an individual's buy-in to a decision that I've made on their behalf is much less than as we talked about at the beginning, this idea that everybody desires self-determination. So what is most powerful is if the patient comes up with a goal themselves and I give them tools to be more successful. And so whatever that goes. So when I think about lifestyle medicine, I'm thinking about on a whole spectrum of things with emotional stress, sleep, nutrition, physical activity, you know, all these different determinants of health. Where are you on any of those, and what would you most like to work on? So that may not be the thing that I recommend based on a cardiovascular risk or a risk of having a heart attack. Maybe I have one priority, but what's going to be most effective is if we work together on what your priority is for yourself, because that's what you're going to be most confident in, and your self-efficacy is going to be greatest, and we're going to have the most chance of success. So if they want to work on their sleep, that's what we'll talk about. If they want to work on their nutrition, that's what we'll focus on. And so it's really coming alongside somebody saying, where are you? Where do you want to be? let's come up with a goal together. Now, it is true that there's a degree, a sense to which when you see your physician, you are expecting certain recommendations, and the recommendations from a physician do have a certain weight that society carries along. And so it's a trust that is placed in physicians, and as a response to that trust, one of the opportunities we have is if I write it down, and I will prescribe a certain that we've negotiated together. So Daryl has said that he's going to walk for 20 minutes 3 times a week during his lunch break for the next 1 month. So it'll be as specific and measurable and outcomes-based as possible. So Daryl knows exactly, what the negotiated kind of agreed on activity was, what the measurable outcomes of that are going to be, and he can remember what the benefit, the outcome benefit is going to be. And so I'll write that down on a prescription pad and sign it, because coming from a physician, it has a little bit of added weight. So I do take advantage of that kind of relationship with the patient to help them along. But really, the fundamental is just this idea of having a very concrete, smart goal.
Well, and I love what you just said about the fact that the physician truly does carry weight. And I think as a society, we recognize physicians as playing an important role in helping us attain our health. And I love this concept of the doctor understanding lifestyle medicine and the training that you're going through. Talk a little bit about the growth of that within the medical profession and the need and some of the things you're seeing to really, because I think that would be so amazing if every primary care physician addressed every patient the way you just described, and really could be use the role and the weight they play to influence people to change lifestyle. So what are you seeing as it relates to the growth of that within your profession?
So what's very interesting actually is I've seen it come from what I would describe as the top down rather than the bottom up. And let me explain that. Is that patients have a sense of their health, but their health literacy varies considerably. So some people have a greater insight into their own health status than others. But who recognizes the value and power of lifestyle medicine is actually the employers and the insurance companies. So they understand very well, because really they're the fundamental payers of our system in the United States outside the government programs. And they understand at a population level what is going to produce a healthier population and therefore a lower cost population as a whole. And so how do we address the prime drivers of ill health in the United States with regard to cardiovascular disease? Well, the underlying is physical activity and nutrition and not smoking and having low stress and sleeping well. And so if we're actually able to address the true underlying causes of disease, not just high cholesterol or high blood pressure, which I would state are actually symptoms of the underlying issue, which is really physical activity and poor nutrition. So if we can actually get at the underlying driver of ill health, and so I'm not satisfied with just saying, let me control your blood pressure, let me place you on a statin because it's going to reduce your risk of having a heart attack. So we'll do those as well, but I want to go to the next level and help you address the underlying drivers of your ill health. And if we do that on a population scale, it turns out the employers and the insurance companies have bought into this hook, line, and sinker. So they understand, and there are large programs coming from mid to large sized employer groups and insurance companies to address lifestyle medicine as part of the strategic direction at a population level. So me as a physician educator, I see that and I think, well, that's actually a strategic direction of the payers in the United States. That means it turns out that a lot of the change in healthcare is coming from those mid to large, those payers, so the insurance companies, the federal government, and the insurance companies. So if they're driving change and lifestyle medicine is part of that change, then I need to push that change down into the physician group. So I, as a physician educator, say, how can I help prepare the physicians to be able to practice in this way? And so taking this lifestyle medicine, not just to my patients, but to my physician trainees and saying, as a curriculum, how can I teach the physicians to be able to practice in this way? So at this stage, that's what we're doing, is how can we teach physicians? Because really, on a day-to-day basis, the physicians are heavily working very hard with regard to short patient visits, high patient volume. They still operate in a fee-for-service model that is very much based on volume. But clearly, we and the entire country are trying to transition to much more of a value-based model than the volume. But the physicians are currently responding to the volume because that's what they're paid on.
Right.
And so the physicians are just a little bit behind, and the payers, because they're now focused on value, are a little bit ahead. But lifestyle medicine fits in that value because you're going to get much better response to a population level health if we focus on the underlying drivers of disease. And it's low cost. It's a lot cheaper to focus on the underlying cause with regard to nutrition and physical activity than it is to give lots of people a medication.
Right. So one of our attendees has asked that we turn his mic on. Bill, I just unmuted you and would just invite you to join us. And if you've got a question, please share.
Well, thanks, Dr. Larson, for all this really great information. But Daryl, you and I have known each other so long that you asked all of the questions I was going to ask for the most part. Dr. Larson, Daryl and I have known each other many years. I work in the field with employers, and so it was encouraging for me to hear you speak of some of that change that you see coming. You know, I know we've kind of said for years, as we've kidded around with each other, that if you're going to really follow change, you have to follow the money, and the guys spending the dollars on, or men and women spending the dollars on healthcare at the employer level, have the ability to really influence change. And I was going to comment this. I'd love your opinion of this. Actually, this a real life employer situation. Daryl, you'll chuckle at this. We've got a group that we're getting ready to engage in right away at their renewal coming up here, and the CEO came over to Daryl's office. We did a presentation, of course, 6 feet apart from each other. Had to add that, right, Daryl? Of doing the presentation appropriately and teaching them about behavioral health. Anyway, he came away from it thinking, you know, this is very cool, but this is way out of my box. So this is a CEO of a construction company, and he said, I just don't know how much my guys are going to use this. And I invited him. I said, listen, let's bring in one of your superintendents to talk about this, and let's talk about the greatest need that he feels is necessary in the field right now with all of your personnel. You know, the guy that you refer to as your boss, because he's running everything in the field relevant to your company. Anyway, we did that on Friday. And it was ironic, the very first thing that popped out of his mouth was, do you have any idea how much stress our people are under out in the field? Do you have any idea how much that's affecting their lives? Do you have any idea that if we have coaches that can help us with goals, can help us with decision-making paradigm, can help us with this process, what kind of influence that's going to have? So I was encouraged to hear you. I'm saying kudos to everything you're saying. I'm encouraged to hear you say, and I maybe just in this last part of question, do you really believe that, I mean, you work for a major corporation, you work for a big group of people, have a lot of influence on people's lives. Do you really think that we are finally at a time when this is the lifestyle choices, the behavioral choices of healthcare are starting to match up with our system, meaning this big monster system that we've created that functions in a world of CPT codes and compensation for hospitals and doctors and providers. And you know, I've been in the industry 35 years, so I'm a guy who gets this change that we've wanted to have come for a long time, where people were really having more control over their healthcare. Do you think the doctors and the people are finally, with the help of the employers, are really starting to get there where real change will happen and we can get away from the wastefulness that we have in the system?
So thank you for your comments and your question. I really do. I really feel like there are some very specific mid to large size companies and insurance groups that really do see the need to focus on some of these long-term determinants So it is true, I've made business proposals and I've had to include near-term cost savings to try and move an employer in a certain direction to have them focus on, what is going to be helpful for their employee group. And so sometimes you have to talk to the CFO and focus on the near-term savings. But I think you are increasingly able to make arguments based on these kind of longer term. So you're correct. It does follow the money, and so you do have to make a case for long-term cost savings to an employer group, for example. But I think you can. I think they're starting to have ears. For example, focusing on behavioral health. You mentioned. So you talked about a construction group. So you talk about productivity. What are the drivers that undermine productivity in a worker group, especially in the context of mental health? Ask these workers, what is their home like? What is their marriage like? Ask them if their relationship with their teenagers affects their ability to focus and be productive at work. And you will discover that their home life and the stresses they feel from outside of work heavily influence. So a wise employer will then say, if I want productive employees that are not taking sick days and various other days off, then I need to empower them and help them outside of work and with these mental health stressors, which usually don't come from the job itself quite as much so as the non-work time in somebody's life. So their marriage, their parenting, their home, whatever is going on at home is impacting their work. So a wise employer will say, there may be a delay, but there may be a cost savings in the long term if I have more productive employees by providing a coach that helps someone with the stresses they're feeling from outside. So I really feel like, and that's just one example in the realm of mental health. We could talk about all sorts of other aspects that lead to productivity for employers. But I do think there are mid to large size companies in the United States that are saying that the current paradigm in which we operate, that is just disease specific, utilizing very expensive medications, is a very limited and short-term goal. And it's time to reorient and focus on a much longer-term goal to have healthy employees. And I think there are employer groups that are banding together to redesign the approach that they're taking. And actually, I think it involves a great deal of taking more ownership for the health of their own employee groups. And so you're seeing this trend towards on-site primary care, this entire movement to on-site, where mid to large size companies are taking more responsibility for the health of their employees, because they realize that in the long term, that is a strategic differentiator. It makes the companies more competitive, where the margins are so narrow between one company and another. What makes the strategic difference is whether or not you have the healthier, more productive work group. That means that you have to focus on the healthy employee in a very broad way. So we're talking quite broadly here, but it's because these factors interplay.
Well, and I think your comment about the fees and where the money comes from for the doctor, and the fact that we're in a system where the more times or the more people a doctor sees, the more money they get to make. A few days ago, we were on one of our guest panelists, we talked about this concept of direct primary care, where the primary care physician is getting a monthly retainer, and now their job is to keep you healthy, and the more healthy they keep you, the more profitable it is for them. Are you familiar? Can you talk a little bit about, from your perspective, how employers and even insurance plans can maybe promote more of that aligned primary care physician payment system?
Yeah, so I think it depends on the strategy that they're taking with regard to the ownership that they take for their own employee group. So how much of the health, because they are the primary drivers of the healthcare dollar, because the money starts from the employer and goes either to an insurance manager and then out, they have the healthcare dollar spend is increasing at such a dramatic rate for American corporations that they cannot not focus on this as a strategic part of their company growth and development. They know they have to focus on this because the rate of healthcare spend as a percentage of their expenses for the company is dramatically overtaking other areas. And I think just about every employer knows this. And so the current model is simply not keeping up with the growth, with the rate at which that is growing. And so I think companies and corporations are now taking it, they're saying we can't wait for our US healthcare system to change. We're going to be the primary drivers of that change, and we're going to take ownership for it ourselves. Hence the growth in the on-site model and the idea to control much more of that healthcare dollar spend. Not control in a bad way, but to say this dollar spend represents the healthy employee, and I am motivated to have healthy employees. So what does that mean? It means having more work environments that produce health, lower stress, break time, working in such a way, whatever way is most productive for that individual, if it's a home or if it's in an office, providing spaces for them to be physically active, provide kitchens or meals during the day that are actually healthy. So not just providing cheeseburgers for everybody, but actually saying, is there a great salad bar that we can provide for our employees? So taking ownership as a strategic direction for the company and saying, I'm going to take responsibility for the healthy employee group and saying, let's provide nutritional lunches, let's provide a space where they can be physically active. And over time, I think we are seeing a trend where companies are seeing that this is going to have a long-term benefit to them.
Love it. So we're running out of time, and as we kind of come to a conclusion here, I'd love to give you, Dr. Larson, a chance to maybe share a last 3 or 4 minutes of things you may have wanted to share today. If you've got some comments, whether it's about the pandemic and the response to that, or as a physician, what are some concluding remarks?
Sure. Well, we've ranged around in our conversation, which has been a lot of fun, and I appreciate that. We started with just thinking about goals in the context of this. And I think I would just take a few minutes to kind of bring it back to that space. Because I think as we think from individuals, and each of us are in this situation where we find ourselves in a situation we didn't desire, there is still some fear around, there is still some uncertainty. We can't get rid of all that fear and uncertainty, but we want to be able to help people and come alongside them and help them think in positive ways that they can start to build momentum towards a more hopeful, positive future. So one of those ways is making goals. And so some of those things that we talked about at the beginning with the end in mind, and some of the things that we start about starting small. I actually think starting small, but sometimes having what I think of a BHAG, a big, hairy, audacious goal, some big, crazy thing that you are just going to put up on the wall and say, I'm going to aim for this. So sometimes it's starting small, and sometimes it's just like having your eye on this like crazy prize. So one of the crazy prizes that I put on the wall is to actually copy my teenager who ran out of the room. She's a 17-year-old and she's just about finished her private pilot's license. So this next month she's going to be a pilot. She's been flying around. Sometimes you will look outside and she's flying a plane around the top of the house, and so she's like achieved this incredible thing. And so my wife is, she's also had this goal. So it's like, maybe I should just learn to fly. Maybe I'll get my private pilot's license. To me, that's a BHAG. It's a big, hairy, audacious goal. That's like, good grief, But sometimes it's just helpful to have some crazy big goal. So my goal is, I'm going to put that on the wall and say, if she can get her private pilot license, so can I. And so, I'm going to come alongside. I'm going to study this material, and I'm going to learn to fly. So this is something we can enjoy and do together as a hobby, really. And so sometimes it's just having that. And then just thinking about, we talked about the SMART goals. I think people are quite familiar. They've perhaps heard of that before, but I do think it helps to kind of remind ourselves of the basics. When we're thinking about making a goal and thinking, let's make it really specific. We talked about writing on that prescription pad exactly what was going to be done, how much, by when, what are we going to do? So make it specific, make it measurable, make it achievable, something that's actually achievable. So learning to fly is some big crazy idea, but it's theoretically achievable, even if it's a little bit big. And then realistic, and then time limited. So when is this going to be accomplished? And at the beginning, I mentioned just the idea that it's self-determined and as a physician, evidence-based. So we want to have an idea that this has been shown to be effective, but it's you coming up with a goal. And so I'm going to facilitate the conversation in such a way that the goal comes from you. And so it's self-determined. So it's specific, measurable, achievable, realistic, and time limited, but self-determined by you and evidence-based. And so, you know, sometimes people think in terms of, you know, problems that may come up when people are thinking about goals. And sometimes people, well, is it possible to have too many goals, too many things that you're working on? And I'm not entirely sure I've decided that yet. My wall next to this monitor is listed with yellow sticky notes, which are all different goals. And they're just yellow sticky notes that are posted right here. And so I generally I came across this quote, and unfortunately, I'm not sure where I found it at this point, but it says, those with the most goals to achieve the most goals. And so it's this idea that the act of making the goal itself is an achievement, and it will build positive energy and motivation as you work on it to build more and more goals. And so it's like rolling a small rock from the top of a hill. You just give it a small little push, but at the bottom of the hill, it's having this mighty effect. And so if you just give a small little push at the top of the hill, and it's going to build on itself, right? And by the bottom of the hill, it could do a great deal of damage. So sometimes people just need a small push at the top. And so having, you know, those with the most goals to achieve the most goals. And so I take the approach that, you know, if my wall is covered with yellow stickies, so be it. And I'm going to choose that having too many goals is not going to be the case. But you do need to be able to adjust. It needs to be individualized. You need to be somewhat flexible, which is definitely challenging for me. But you do need to be able to adjust. You want to have some follow-up on it. And but the biggest mistake is not setting goals in the first place. And so I think starting with the end in mind and just starting with something small, the biggest problem being not setting them in the first place. So I think, yeah, that's my thought.
Dr. Larson, this has been fantastic. Thank you so much. Let me just mention for our listeners that this Wednesday, our guest panelist will be Dr. Donna Milovitz. She's the Senior Vice President of Steward Medical Group for Utah and Arizona. Donna will be sharing thoughts and ideas about partnering with your physician to stay healthy. So somewhat of a continuation of what we talked about today. There will be a post-huddle survey. We encourage people to fill that out to give us feedback on how we can make things better, as well as ideas and themes and topics for future huddles, or recommend future guest panelists. Use the Contact Us form on the Going on Offense website to communicate with us. And we want to again thank Dr. Larson for his remarkable and fun involvement today. Thank you so very much.
Thank you, Daryl. It's been an honor being with you. Thank you.
We also want to thank the organizations that have gotten behind this movement. They've made some wonderful offers. There's a tremendous amount of resources that are available on the Going on Offense website. Encourage people to take advantage of those. We will be posting the recording of this huddle on that website later today. And in conclusion, I'd like to play a video that one of my staff members found that's incredible. It's about helping others and the happiness it can bring into our lives. I'll sign off now and say goodbye and hope that you'll join us again in an upcoming huddle. We have them every Monday, Wednesday, and Friday.